Hey, welcome to The Explainer. Today, we're going to play medical detective and figure out what's really going on when you find one of those mysterious swollen lymph nodes. You know that feeling, right? You're in the shower or maybe just getting ready for the day, and your fingers brush past it, that unexpected little lump. That split second of, whoa, what is that, is exactly what brings so many of us to a doctor's office. So there's a fancy medical name for this, lymphadenopathy. I know, it sounds super complicated, but really, all it means is that your lymph nodes are swollen. You should think of these nodes as little security checkpoints all over your body. They're a totally normal and crucial part of your immune system, always on the lookout for trouble. All right, so let's start thinking like a doctor. When they see a swollen node, the very first thing they ask is a really simple question. Is this just in one spot, or is it happening all over? Let's put this into practice with our first case. Picture this. A 22-year-old guy, perfectly healthy, finds this single, kind of painful lump on his neck. And here's the key clue. He also noticed a little patch of irritated skin right nearby. This is a classic. And that right there brings us to this really important difference. We call it localized when the swelling is just in one area, like with our guy's neck. But if it's in two or more totally separate spots, like, say, your neck and your armpit, that's called generalized. And trust me, that one little difference changes the entire investigation. Now, here's the good news. The vast majority of cases, we're talking like 3 out of every 4, are that localized type. So most of the time, it just means your body is fighting a small, contained battle. So what about our 22-year-old? Well, his diagnosis was super straightforward. It was just a minor skin infection called folliculitis. The nearby lymph node, that little security guard, was just doing its job, waving a red flag. A round of antibiotics cleared up the skin, and poof, the lymph node went right back to normal. Okay, so this leads us perfectly into clue number 2. The location of a swollen node is never an accident. Seriously, think of it like a pin on a map. It's pointing you right to where the action is. See, your body has this amazing and super predictable drainage system. This chart shows it perfectly. If you have a node in your neck, it's almost certainly reacting to something in your throat or your head. A node in your armpit, it's looking at your arm or chest. This map is incredible because it helps doctors zero in on the cause so much faster. Okay, so we know location matters, but when does a doctor go from, let's just keep an eye on this, to, we need to look closer? What are the actual red flags? To figure that out, let's look at case number 2, which is a little trickier. We have a 58-year-old woman. A doctor finds a single node on her neck, but this time it's painless. And unlike our first case, there's no obvious cause, no little skin infection nearby. This is where the real detective work begins. Doctors basically have a checklist of things that make them feel better about a swollen node. Generally, if you're younger, the node is pretty small, it hasn't been there long, and it's soft, maybe even a little sore to the touch. Those are all good signs. They point to your body just doing its thing, reacting to something simple. But on the other hand, here are the things that make a doctor pause and say, okay, let's investigate. Being over 50 is one. A node that's bigger, say over a centimeter, and has stuck around for more than a month, that's another. Or if it feels really firm or rubbery, isn't painful at all. Or, and this is a big one, it's located right above your collarbone. Any of those will definitely trigger a closer look. So for someone like our 58-year-old woman who kind of has a mix of features, doctors often take this really smart approach called watchful waiting. It's exactly what it sounds like. Instead of jumping straight to an invasive procedure like a biopsy, they just watch it for a few weeks. If it shrinks or goes away, great, problem solved. If it sticks around or gets bigger, then you move on to the next step. But what if the clues aren't pointing to one little spot? What happens when it looks like a system-wide alert? This is where we get into that generalized lymphadenopathy. Okay, let's look at our final case. A 33-year-old woman comes in, and she doesn't just have one lump. She's got swollen nodes in her neck, her armpits, and her groin. On top of that, she's got fevers and is just exhausted. Her body is basically screaming that this isn't just one little problem. The investigation has to go wide. And this chart really shows you why. When the swelling is generalized like this, doctors have to cast a really wide net. I mean, the cause could be anything from a big infection like mono to something more serious like a malignancy, or even an autoimmune disease or a weird reaction to a drug. It's a whole different ballgame. All right, let's crack this final case and then tie everything we've talked about together with a few key takeaways you can actually use. So, after running some tests, they figured it out. Our third patient had something called toxoplasmosis, which is a pretty common parasitic infection. And the biggest clue? It came from her history. Turns out she'd just been cat sitting for a neighbor. A quick blood test confirmed it, and that was that. Okay, so let's recap the big ideas here. First, most swollen nodes are localized and totally harmless. It's just your body fighting a small battle. Second, location, location, location. It's a huge clue. Third, doctors use that mental checklist of features to figure out the risk level. And finally, if the swelling is all over the place, that kicks off a much bigger search for a body-wide cause. You see, figuring out a swollen lymph node isn't just about that one lump. It's a fantastic reminder that our bodies are talking to us all the time. Learning to listen to those signals, not with panic, but just with a little awareness, well, that's really the first step in taking charge of our own health.